even in a healthy person, young person, associated heart is sometimes heart will hold it. If the hole is there, we will close, correct it, and the heart can be used in a younger patients. That is one thing. Other thing is, as he mentioned in Australia, in Sydney only, first time it was done in 2015. That is, if somebody is brain dead, but the heart is still beating, heart will beat, oxygen is going into the lungs, still he is. In the end, the heart will just stop. So those type of heart, நம்ம எடுத்துட்டு இந்த மாதிரி the machine is there where it supplies oxygenated blood into the heart. So அதில் keep giving blood and see how the heart is performing. Some heart may not be usable in these type of hearts where the heart stops like itself and resuscitating the heart. But few of them are usable. So other than that, we can get more donors. Because India on the brain dead only we are using that. If they can get this also passed medically, then we will get more donors. But we need machines to transport, and the machine is there, you can transport for longer distances and maybe few hours the heart will be stunned because blood supply is going into the heart. Whereas at the moment what we are doing is stopping the heart and then transporting it to the nearest place by air and then green corridor. Up to 3-4 hours the heart is stopped already. Other machines probably we will be getting it soon. I think is it available here?
No, sir, it's not available.
Not available. So that abroad they put this on the machine and supply blood to the heart. Heart will keep on beating because it is like normal. Oxygenated blood is going into the coronary artery, supplying the heart and the muscle. So it will withstand hours of transportation without any problem because distances, especially in the, I was talking to them in the US. So from California to New York, they can transport the heart. Because the whole country, they have only one system. Wherever who is listed in priority, whichever may be the state, the heart will be transported. So effective is the system there. Because people are, so many patients are, whatever artificial resuscitative measures like artificial implantation of artificial heart inside, all those things, artificial pumps inside the heart. Adhikella side effect is there because anticoagulants, battery to be connected from outside. The best treatment of heart failure today is heart transplantation. Because all other things have its own problems. Your artificial heart, left ventricular assist device, that is expensive. It may cost like 50-75 lakhs. The battery has to be connected outside to work. The patient has to carry the infection or blood thinning tablets. So it's sort of there are people living like that, but it's not, especially in our situation, it is not as good as the results in other countries because they are very well organized. In the transplant, a separate department and just to look after the patients, separate cardiologists are there visiting different hospitals, patient association, follow up. We don't have at present that sort of facilities in our country. So we are doing with the limited facilities what we can do. What is ideal is not practicable. If you wait for an ideal situation, we will never do anything in this country. So we have to modify things and make sure we do things almost the same level in the finance, insurance, all these are big problems.
After transplantation, can the patient be lead a normal life?
Absolutely. Important, that is the important thing. No? See if patient is taking enough medicines, tests are done properly. They can, because these medicines also are expensive. What happens is unless they can afford to take this medicine, doing a transplant sometimes may not be a good thing also. They cannot afford suddenly, their longevity is less. That is why the people living after transplant, taken care of, they can lead a normal life, 20 years, 15 years. A lot of people doing all normal, even mountaineering, playing tennis, all those people are doing.
Sir, any age limit is there?
Age limit as such, it's 65, 65?
That depends. Like most probably we prefer taking donors up to 40 years, but beyond 40 years, then we have to assess them further. Up to 50 and 55 we do take.
You are talking about recipient or donor?
Donors, that's what they are.
I don't know.
Oh, recipient.
Yeah, must be.
Recipient,
You are asking about recipient or donor?
Donor.
donor, what I said is right. I'm like, we usually assess patients up to 40 years. And beyond 40 years, then we have to evaluate them further, like, because some patients might be having coronary artery, coronary artery disease. So we have to evaluate them. Then further, after good, if the heart is found to be good, then we can go ahead with the transplantation.
The donor age is nearly 25 years.
Yeah, we can go. Yeah.
We can donate. That suits for above 60 years patients.
Above 60 years, no. I mean, like, we usually don't go ahead with old older donors because they might have associated cardiac disease. So we usually prefer young donors and preferably less than 40 years.
Rajiv?
Yes.
What is the rejection rate of the transplant in India and world?
So the rejection rate is up to 5 to 8%, if I'm right, for the DVD donors, for the brain dead donors, and it's almost the same in India. The main cause for rejection is the adherence to the medications that the patients are taking. So if they're adherent, they're compliant, then they can survive for a longer period of time without rejection. So if you're talking about immediate rejection, it's just about 5 to 8%.
Sir, how long period that the patient need to meditate?
I didn't get your question, sorry.
Patient, how long period he needs the meditation?
Medications. So it's lifelong. He is on an immunosuppressant, which reduces the immunity so that the chance for rejection of the donor heart is less. We are reducing his immunity so that he doesn't develop antibodies against the donor heart. So it's a lifelong treatment. Yeah.
சார் அந்த ஆர்கன் எவ்வளவு நேரம் டிராவல் ஆச்சு சார் எவ்வளவு நேரத்துல 1 ஹவர்ஸ்ல ஆபரேட் பண்ணிட்டீங்க கொண்டு வந்தது எவ்வளவு நேரம் எப்படி கொண்டு வந்தீங்க
It's within 20 minutes. By road.
எங்க இருந்து இருக்குது
So any special permissions ஏதாவது வாங்கிருந்தீங்களா கொண்டு வரதுக்கு?
No, we didn't ask for any permission. It was done in the early morning, so we had we had no issues.
Trafficல
No. Like it was early in the morning, so we didn't have
From
any
where
issues.
you harvested this organ?
You're not supposed to.
Private hospital, yeah, within Chennai.
Within general, we are for confidentiality of the donor, we are not supposed to medically tell you where and whose body harvested. It has been in the city of Chennai only. So we did ask for a green channel because the police are willing to give us because this, I must tell you that Tamil Nadu is the most organized sector in organ transplant. So we should be all proud of that because
பரம்பரையா வந்து அது எப்படி உங்க அப்பா சின்ன வயசுலயே கண்டுபிடிச்சிருக்காங்க
cardiomyopathy, see, cardiomyopathy could be primarily muscle weakness தனியா வரலாம். So many varieties are there. Heart muscle ரொம்ப hypertrophy சொல்லுவாங்க. Hypertrophic cardiomyopathy வேற ஒரு விஷயம். This is all genetically acquired only. அப்புறம் வந்து severe valve heart disease வந்துட்டு operation பண்ற patient, they are going to heart failure. No way we can treat with the medicine. Heart attack வந்துட்டு bypass பண்ண patient heart failure வரலாம். Young patients like 50-year-old, multiple blocks, stenting, 2-3 heart operations, patient with persistent heart failure, we do transplant. Then children with complicated heart problem by birth, they also undergo operations initially because this is the last resort. Heart transplantation, everybody thinking if you put a new heart, everything is fine. It's not like that. As we are telling about the problems related to taking medicines, taking tests and all those things. So we try all the measures because for heart failure, there are medicines, advanced treatments are there medically, a lot of them we can manage. When the patient is not able to carry out his normal activities with optimal medication, maximum medicine for that effective only we have to transplant. It is so there are many indications. Other than this cardiomyopathy is one of them.
சார் ஹார்ட் டிரான்ஸ்பிளான்ட்டுக்கு சேரும்போது திடீர்னு கார்டியோ அரெஸ்ட் ஆகுது அதனால பேஷண்ட்ஸ்க்கு ஏதாவது ப்ராப்ளம் நீங்க ஏதாவது சேலஞ்சஸ் ஃபேஸ்
இல்ல ஹார்ட் நம்ம எடுக்கும்போது we support the body with heart lung machine. இப்போ ഇപ്പോൾ ഒരു ഹാർട്ട് ട്രാൻസ്പ്ലാന്റ് പറഞ്ഞ പേഷ്യന്റ് ഡോണർ ഹാർട്ട് കിടച്ച് എല്ലാം ക്ലിയർ ആയ പിറകെ വി പുട്ട് ദ പേഷ്യന്റ് ഓൺ ഹാർട്ട് ലങ് മെഷീൻ. അപ്പോൾ ഹാർട്ട് ആൻഡ് ലങ്സ് വിൽ സ്റ്റോപ്പ്. So the function of the body is taken by the heart lung machine. Then we connect the donor heart to the recipient like the video he showed. And then give blood to this heart. Heart will take over, will disconnect the heart lung machine. அப்படிதான் work பண்றது. Because heart எடுக்கும்போது he has to be alive. No? At the end of the operation, otherwise patient will be brain dead. All the organs will go. So once we make sure, okay, the donor heart is good, the heart is going to come, say X amount of time. On the way there is no problem. Then only we wheel the patient inside, open the chest, put the patient in the heart lung machine, remove the heart and put it. So that is what the importance of transplant coordinator. They are very important part of this team. We are all in a WhatsApp group. Okay, heart is stopped.
What is the duration, sir?
Only I think we every 20 minutes.
Explant to implant was around 4.5 hours.
No, I mean,
No,
like,
no, no.
the surgery as such was within 1 hour or so.
Yeah, within an hour we finished.
Yeah,
See, to
total.
do this operation, the first time to do the operation is when we do much more complex operations than heart transplant. Technically, it is of course difficult operation, but I won't say it is very, very complicated. Especially when you are doing like a patient who had already had a heart operation, doing a transplant, it is more difficult. When somebody like this boy who comes, usually we finish stitching in about half an hour to 45 minutes. Actual time to stitch the heart will be 45 minutes in experienced hands. And then we'll have to support the heart. Sometimes, but transplant when you give blood to the heart may not pick up by itself immediately. So, heart lung machine, the first heart transplant we did to support the patient in another hospital where I was there before. Support the heart for 3 hours. I thought the heart will not pick up. Adilana, heart lung machine, we have got other supporting measures. We can support it for days. Some patients, especially heart, lung, and transplant, we call ECMO, which was put for our previous chief minister. She was put on the ECMO support. That is our life support. It is. We can put for 2 weeks, 3 weeks, 1 month, no problem. Heart may recover. So all those support systems are unfortunately. In our setup, all these comes with a price. It's all expensive measures. Everything is available, we have. So one has to, spend a lot of money for all these things. That is the only thing, because we don't have a health insurance to a large level. These are all, we can't predict. When you accept a patient, we can't predict, okay, X amount of time, X amount of money will go or not. If you are lucky, everything goes well, everything is fine. Then will be, yeah.
Seven, sir.
Sir, totally
Congrats. Congratulations, sir.
operation.
Ah.
Sir,
See, the group includes, I don't know, maybe about 50 people will be there. If you look at all the things involved from transportation to coordination. See, I was waiting, I was walking from my house with my shirt in my hand to reach where the ambulance was coming from the hospital because they informed me, sir, everything is ready, come. So I ran from my house even without telling my wife because we wanted to reach as fast as possible. Ambulance could not turn into my house, so 50 meters I ran to get into the ambulance and Fadafat we came at 5:30. So I'm just giving an example. So we all are on our toes when you do these things because time is important in life and time is very important.
Chairman, sir, congratulations sir, for providing excellent infrastructure for the process. So, what would be your suggestion to the government?
Question to you.
Actually, after seeing this and before what we were discussing, we will give a request to the government how it is treated in other countries. We will request the central government and state government to give the permission. What they explain, we will try to get it. Not only that, and our team, all our group, our doctors, actually I have to appreciate them on this juncture, not the management alone. They themselves are having the international views and ideas and exposure to serve the nation and the public. I have to appreciate and congratulate the entire team of SIMS Hospital.
சார் இப்போ ஃபர்ஸ்ட் டைம் வந்து இப்போ நீங்க வந்து அந்த டிரான்ஸ்பிளான்ட் பண்றோம் இவங்ககிட்ட சொன்ன உடனே ஓகே சொல்லிட்டீங்களா?
அவங்க எல்லாருமே கரெக்டாக அவங்க ஆக்ட் ஆன் தேர் ஓன் பிகாஸ் இது பீங் எ ஹாஸ்பிட்டல் எவ்ரிபடி ஹேஸ் தேர் ஓன் ரெஸ்பான்சிபிலிட்டி. அதனால அவங்க என்ன பண்ணணுமோ அந்த ப்ரொசீஜரை இமீடியட்டாக அவங்க பாட்டுக்கு டீல் பண்ணுவாங்க. ஏதாவது ஒரு அப்நார்மல்னால நம்மக்கிட்ட வருவாங்க. ஃபர்ஸ்ட் செகண்ட் கிடையாது. பிகாஸ் டெய்லி இஆர்ல பேஷண்ட் இருப்பாங்க, நிறைய விஷயங்கள் நடந்துட்டு இருக்கும். தே ஆர் ஆல் ரெஸ்பான்சிபிலிட்டி.
சார் இப்போ இந்த உடல் உறுப்புகள்லாம் வேணும்னா பதிவு பண்றது இந்த டிரான்ஸ்பிளான்ட்லாம் எப்படி கவர்மெண்ட்ல செயல்படுதுன்னு நினைக்கிறீங்க? எல்லாருமே பிரைவேட்டுக்கு வர முடியாது. இப்போ காஸ்ட்லாம் எவ்வளோ ஹைக்கா இருக்கும்னு நினைக்கிறது. கவர்மெண்ட்ல வந்து இது ஈஸியா கிடைக்கணும், என்னெல்லாம் பண்ணணும், டிரான்ஸ்பிளான்ட் எப்படி டெவலப் பண்ணணும்னு நினைக்கிறீங்க சார்?
சி இப்போ வந்து கவர்மெண்ட்ல சர்டன் ப்ரொசீஜர்ஸ் டாக்டர் சொன்ன மாதிரி நம்ம தமிழ்நாடு ரொம்ப ஸ்ட்ரிக்டா இருக்காங்க. ஸ்ட்ரிக்டா இருக்கிறது தப்பு இல்லை. அதே சமயம் நிறைய தேவைகள் இருக்கு. சயின்ஸ் அண்ட் டெக்னாலஜி டெய்லி வளர்ந்துட்டு இருக்கு. ப்ராப்பரா நம்ம சோஷியல் ரெஸ்பான்சிபிலிட்டியோட என்ன நிறைய இடத்துல அது மிஸ்யூஸும் பண்றாங்க. அது இல்லாமல் நம்ம வந்து டிரான்ஸ்பிளான்ட்டுக்கு ஃபுல் பர்மிஷன் கொடுக்கணுங்கிறது என்னுடைய கருத்து. இன்சூரன்ஸும் அதே மாதிரி பார்த்தா நிறைய பேர் சொல்றாங்க இப்போ வந்து இவ்வளவுதான் வேல்யூ அவ்வளோ வேல்யூன்னு. அதை வந்து இன்னும் இன்க்ரீஸ் பண்ணலாம். பப்ளிக்கு அவங்க வேணுங்கிற மாதிரி இன்சூரன்ஸ் எடுத்துக்கிறதுக்கு பாலிசிஸை பெருசு பண்ணணுன்றது என்னுடைய கருத்து வைக்கும்.
சார் இப்போ இது 20 மினிட்ஸ்ல இதை கொண்டு வந்து நம்ம பண்ணியிருக்கோம். அது இன்ஃப்ராஸ்ட்ரக்சர்லாம் நம்ம கிட்ட நீங்க முன்கூட்டியே இருந்ததா இல்லை இப்போதான் நம்ம
இல்ல நமக்கு எப்பவுமே அந்த மாதிரி இன்ஃப்ராஸ்ட்ரக்சர் எல்லாத்துக்குமே இருக்குது. வாட் எவர் சாருக்கு சொத்து அவங்க டாக்டர் சொன்ன மாதிரி ஹார்ட் லங் மிஷின்ல இருந்து எல்லாமே வாட் எவர் ஹியர்ஸ் ஹியர் பெஸ்ட் குவாலிட்டி மிஷின்ஸ் ஹாஸ்பிட்டல். அதுல காம்ப்ரமைஸ் கிடையாது. பெஸ்ட் ஹேண்ட்ஸ் மோர் தென் தி இன்ஸ்ட்ருமெண்ட்ஸ் பெஸ்ட் ஹேண்ட்ஸ். அதே போல என்னுடைய இது என்னன்னா நம்ம டீம் வந்து ஒரு ஈகோ இல்லாம டாக்டர் சொன்னாங்க டிரான்ஸ்போர்ட் டிபார்ட்மெண்ட்டை கூட சேர்த்துக்கிட்டாங்க. டிரான்ஸ்போர்ட்ல இருந்து டாக்டர்ஸ் வரைக்கும் தே ட்ரீட் வெரி வெல். ஸோ அது மாதிரி ஒரு எண்ணம் கொண்டவங்களால தான் செயல்படுத்தணும்.
Good. This is another video. This is another donor heart that I could get a hold of. So this is again, this page, I'm like, important thing about this donor heart assessment is that we have to see every aspect of the, I mean like even the heart rhythm, how it beats, whether the chambers are dilated or not. And I will show you a video here. You can see actually the heart is fully dilated, and it's, so this is where we are in a dilemma whether to take this heart. Might be from a young donor, but we have to assess it very carefully because this is a gift of life. This is almost like a gift that we are giving to the recipient. So it has to be proper, and you have to evaluate carefully. So we eventually rejected this heart because all the chambers are dilated. So that's the importance of not just the recipient end. I mean, like, not just the surgery is important, also the donor assessment is important. Because the one who goes to the donor site has to assess the heart, and he has to communicate with the recipient and has to give all the assessment details so that the recipient also, I mean, like, the place where the surgery is being done, the heart transplantation being done, they have to know that if there is something missing, or they have to be ready with any extra graft or some parts. So donor assessment is very important in heart transplantation. So having said that, we have a lot of donors, but however the waiting list is very long. And in India we do practice something called donation after brain death, which is being followed in most of the South Asian countries. But that's eventually, I mean, like, there is a new, it's not a new concept. This has been done since 2015. The concept is called donation after circulatory death. So it is being, it's the type of heart transplantation where they do when the heart literally stops. There is no beat, there is no ECG rhythm, it's a flat line. And we go in, we take the heart out and do the transplantation. It's not ethically approved here in India, but we have been doing this in North America. So this is a special organ perfusion system. So we get the heart out. This is the arrested heart, and we connect it to the tubes. So So you can see that this is the major vessel I told earlier, right? The aorta being connected. This is the main vessel. So it has something called coronary vessels, coronary blood vessels, which is the main important vessel that supplies the blood to the heart. So the prime aim of this procedure is to perfuse the heart, give the blood flow to the heart, and by giving the blood, we are giving the blood to the coronaries and supply the oxygen to the heart that is being taken. So you can see my assistant connecting to the aorta to the TCD. That's the organ perfusion system. This is the organ perfusion system. So this is where the blood goes into the aorta, and you can see. So the most important aspect of this procedure is we have to be very meticulous, because you can see my surgeon pressing on the heart slowly, because even if you give the blood to the heart, it tends to distend. If it distends, then it can cause further ischemia and damage to the heart muscles also. So we should be very careful, because we can't press too hard, and we should be very cautious, and we have to make sure that it is not distant, it's not enlarging as well. So as we do keep doing it, this is the final. So after we take out the heart, this is the blood supply going to the heart, and heart starts beating, and we take this heart in this organ perfusion system from the donor side to the recipient, and where we do the heart transplantation. So this is a totally different concept, and it's been there for almost 10 years, 10 to 15 years. The first DCD was done in Australia, and it's been fact like it's the number of DCDs has increased a lot, and almost equal to the number of donation after brain death in North America. So this is basically to say the fact that there are ways of harvesting the donors. It's not just the brain dead donors that we have to totally rely upon. We can go ahead with the DCDs, but having said that, if we get this ethical approval and everything goes ahead, and this is really a viable opportunity for us to get more donor hearts rather than entirely depending on our brain dead donors. So that's what I would like to emphasize here. And the most important thing is that organ donation. We have the organ donation day tomorrow, so we would like to emphasize that organ donation is most important thing in case, because we have a lot of heart failure patients and who are there in the waiting list, and the number of patients who die on the waiting for a good heart is increasing. So we have to address this issue, and on this special occasion, I would like to emphasize that we make this organ donation awareness much more. We have to emphasize on that and make it more happening. Yeah. Thank you.
Thank you, sir. Thank you for the wonderful presentation. Now moving on to the media interaction session. The floor is open for questions.
जी